Hey, this is Doug Field along with my co-host Brent Macy and our guest host Liz Frayer, and welcome back to Healthcare Consumers Radio. Liz, let's talk a little bit about Intrepid and tell our audience a little bit about Intrepid, what you guys are doing, the type of clients you work with, et cetera.
Sure. So we, well, a little bit of history I think that's important to kind of get to the name. I actually started in the agency in more of a support position when I was 22 as a temp.
Wow.
And, majored in...
That was only 4 years ago. Right?
Yeah, thank you. It definitely was. So, never planned to really be in this business, but came along and figured I enjoyed it and was able to serve clients well and those type of things. So, in April of 2013, I actually had the opportunity to buy my agency.
Oh, wow.
So when you're thinking about a name, I tell people that, there's a lot of names for somebody who buys a health insurance agency the year before healthcare reform goes into full effect. But my favorite name that you could call somebody like that is Fearless, and so we thought Intrepid was a cooler way to say that.
Great name.
And
Great name.
Thank you. And it kind of jives with our philosophy, which is pushing the envelope, thinking outside of the box. And so that's really what we want to be known for.
That's great. What's your typical client?
We typically serve employers. We have different teams, but we typically serve employers between 20 and 1,500 employees. And so we are working with them on their consulting and plan design, servicing the plan, and also keeping them into compliance. So those are the three areas that we like to focus on.
Liz, what are the major renewal discussions you're having right now with your clients? I know you've had them, but you're having that. What's been the kind of the mindset on renewals with your client?
I think last year everybody was just really scared. Yeah. We have about 60 12-1 renewals in my office right now. So my people, we were ordering in lunch, we were drinking coffee nonstop. Groups that grandmothered their plans early that were in the small group space. I think it gets to what I was saying before is that for us, the conversations are a lot more engaging. You have some employers that take your recommendations. You want to build those relationships that when your employer says, hey, that sounds a little too complicated, or, that seems maybe a little bit too hard or a little far out. Our goal is to build a relationship with the employers that, we push back on that a little bit. And we challenge them, and we want them to challenge us. We actually just lost an account that we had tried to persuade to choose us as their consultant, and the feedback that they gave is they said, we're looking for somebody a little bit more traditional. And that is probably the best reason I could have ever lost a case.
Yeah.
We've high-fived each other and said, hey, we really want to be different in this space. And so employers were a little bit sheepish last year, and now I think they're ready to go, and we're excited about that. I
think, can the same be said for, we talked on the first segment about exchanges. I mean, it's a popular topic right now because it is so disruptive. I think there's a lot more employees moving into exchange than people realize. I think that's going to be an outcome coming out. But I think still, this plan years, a lot of employers, and even those more traditional employers, are waiting to look. Do you see that as they start to see positive results emerge from different employee demographics? Because I think that's the thing. Everyone gets started, and everyone understands Walgreens. Everyone understands those with part-time employees. But when you start seeing some of the more traditional employers move to exchanges, my feeling is that you're going to see more. It's going to be like Oklahoma land rush. You're going to see employers really open up.
Well, it's like when UPS dropped spousal coverage for spouses who were covered elsewhere. That story, and there were a couple, I think I've got the company right, a couple employers to follow, that said, well, hey, if this big company, household name, is doing that, is this something that we should investigate? Yeah. So I think that there's definitely companies being trendsetters. I know that FedEx, we read, moved to an all HSA plan, which I think is awesome. And so when I'm meeting with employers and they think I'm a little bit nuts, I say, hey, FedEx just did this. And it adds some credibility to the strategy and the belief that an HSA plan is going to hold healthcare costs down longer for the longer term.
So Liz, some of what I'm hearing, is there still a big education process with these employers on, hey, this HSA is a good option for your employees, and and really does get them moving towards consumerism? Is it an education thing right now?
It definitely is. And you know, I've kind of taken my challenging employers and kind of gone directly to their employees in some instance. And, you know, I quote this article that I'm sure I get the facts wrong, but I do it anyway. And it, you know, I read this article. It says, you know, people take 2 hours to research and pick out what kind of flat screen TV they choose, and then when they go to select benefits, they pick 15 minutes. Yep. And you know, when we are communicating with employees, we're letting them know, hey, this is a team effort, and your employer, you know, needs your help and needs your encouragement. And so we are basically letting employees know, hey, thanks for coming to the open enrollment meeting, but that's not where your responsibility and your engagement is going to start and end.
Yep. With the, you know, wellness is a big piece of consumerism, and I think, you know, Doug, you talk about it all the time. Wellness has been around forever. But, Liz, what are you seeing as far as trends in with wellness?
You know, I think ACA a little bit kind of sidetracked the wellness trend a little bit. But what I'm seeing is employers where wellness is part of their culture is it's getting deeper part of their culture. I was at a meeting this morning. We had a 7 o'clock meeting. The director of finance looked at his watch. He says, when do you have to leave? I told him, and he said, okay, we need to go down. It's stretch time. And they had, you know, maybe 20 employees. You know, it's a big company. They had 20 employees there on site, a little Bluetooth radio in the middle, and an employee leading their stretch exercise.
Wow.
And, I mean, you couldn't take wellness out of their culture. It's just who they are. And so, you know, I think a few years ago when wellness really started to get big, we had employers who asked us about wellness because they thought that they should, not because they were really fully committed to, you know, making that change. And again, getting back to my challenging questions, you know, I would have an employer ask me about wellness, and I'd say, I don't think you want to do wellness. They'd say, no, we do. We heard it saves money. I said, you have a 3-foot-high candy jar on the reception desk. You can't do both. Yeah. And so
that's well said, because you will fail if you.
That's it. So we saw a lot of crash and burns, and we still see that. And we want to help our employers accomplish their goals, but we don't want it to be a flyer that people get or a payroll stuffer. We want it to be, you know, part of their culture and become who they are.
We see too, Liz, and I'd be curious to your response to this. We see employers now taking a relook at wellness from an ROI standpoint and looking at it more as, you know, this is a risk management and productivity program for us. It can help us manage the risk, particularly if on the assessment side we identify, you know, people with maybe emerging chronic conditions, and we can help prevent that. On the productivity side, because if we have happier and healthier employees, it is going to improve productivity, and less on the big returns that were promised about wellness, you know, 5-to-1 return. I mean, those days are gone, and let's look at it as the core of our business. And I think also still as a retention tool. I heard that yesterday, you know, as a retention tool.
So, you know, we have every time we do on-site screenings with an employer, we find somebody who's diabetic and doesn't know it. Sometimes we send people to the ER because their blood pressure is through the roof. You know, as a consultant, it's much more meaningful, and we feel like we've contributed, you know, to just the greater, bigger picture when we can help people, you know, uncover these conditions and help them have the tools to manage them. So, you know, that's much more fun as a consultant than going out and saying, okay, your rates went up X amount, you could raise the deductible, do this. I mean, it's that conversation, you know, we want to change that conversation.
There's a lot of.
Sorry, Brett. Do you also have to educate that employer on the fact that, you know, when you first do these health assessments, you know, you may see your costs rise in the first year or so because we may identify some conditions that need to be taken care of.
Yeah, absolutely. Absolutely. We tell them that medication is going to pick up, but that's not a bad thing. It's right. Part of our plan.
Now, Liz, there's a lot of, you know, the healthcare law and compliance issues are always out there. What are you seeing and hearing from the employers around compliance right now?
Yeah, my same employer this morning, and it's a newer client for us. I said, well, now part of your wellness program, and they've really developed this themselves, said I ran it by the attorney, and he looked like he wanted to put his fingers in his ears and just pretend like he didn't hear, but I explained to him it's my job to to make him aware. The compliance piece is really important, and employers need to make sure they understand those rules and they know where the bogeys are, and they put in place the administrative component that is the necessary evil to administering the wellness plan.
Yeah, hopefully, I think that, I don't know your opinion on this, but I think the ACA has brought some really positive things. I think the challenges that it brought is all the hidden costs for the employers, and hopefully maybe we can get some of that change going forward, depending on what happens. That the parties to be in Washington, whatever sides, to understand that there's good parts of this law, there's other parts that maybe we need to work on and fix, to not put such a burden on employers.
Yeah, well, having that wellness spread be increased under ACA is, in my opinion, for people who don't like the law wholesale, is really the silver lining and is the tool that we have to control health care costs.
I think things like the employer mandate, some of the other hidden fees, they can go away. I think the employer mandate, quite frankly, is a little bit, it's not there and intended to do, because I think the employers that have benefits, they weren't going to get rid of them anyway.
No, well, it's funny because I have employers say, everybody knows those people. Well, forget it, I'm dropping coverage and I'm going to pay the penalty. And when we do our assessment, what we learn is they are so far away from the minimum that they have to provide.
Right.
And I think the law, in some respects, it has the opposite effect, where employers will say, oh, you mean we don't have to do this much? We could do it a little bit less. And so I think that's kind of falls into the unintended consequence category.
Yeah, just like to your point, the Cadillac tax. Any smart employer saying, we're not paying a Cadillac tax. We're just going to reduce the amount of benefits.
Yeah, right.
Now, Liz, what are you kind of looking into your crystal ball? What do you see, for next year and maybe the year beyond that, as far as the direction you want to take your employer clients there with Intrepid?
Well, the carriers have developed a lot of self-funded products that are more appropriate for the smaller employers that we work with, and so we want to make sure that we're promoting that and putting it in place when appropriate. Information is power, and so when you buy one of those programs, you get more data, and that's more tools and more information that we can work with. We also are involved with a medical captive, so the group that we work with just hit 100 employers, where the employers have a commitment to do wellness and basically share in the stop-loss risk. And so that's going to be a great transition tool for small employers to get into the self-funded space. And so we're excited about that, too.
Is that Apollo? You work with Apollo?
No, we work with a group called Pareto out of Philadelphia.
Oh, yeah, okay, I know. Yeah.
They're super smart guys.
Yeah, then we heard a lot about the captives, and that is, I know those have been around for a while, but that is a very good option for those employers to share that cost.
Yeah, well, it's like self-funding with training wheels, and similar to what you guys do. They have a members meeting where ideas are shared, and so an employer can say, "Hey, we put in telemedicine and it saved this much," and so it's very collaborative, and there's also accountability. If you're not doing the wellness steps, you get voted off the island, and so
wow.
So it's a big decision for an employer to go into one of those arrangements. But it's really cool, and the ideas that are coming out of those type of arrangements similar to the Institute are really neat and fun to talk about and learn about.
Liz, let our audience know how they can contact you about your services.
Sure. You can like us on Facebook at Intrepid7.com. My name is Liz Frayer, Frayer, and you can find me on LinkedIn, and our website is Intrepid7.com.
All right. Thanks so much for joining us in studio, and you're going to be here with us for the next guest.
That sounds great. I'm going to grill them like you guys grill me.
All right. All right, everybody. Stay tuned for the next segment of Healthcare Consumerism Radio.